John Jenkins. I'm the project manager for the World Health Organization for Palestine, and my colleague Noha is the Community Development Officer for the Ministry of Health for Palestine, and we are here to look at how services are delivered to the islands because there are similar situations of places fairly remote which don't have easy access in Palestine like here, to look how services are provided in these circumstances.
And is it specifically mental health services that you're looking at, or health services in general?
No, it's only mental health. It's services for people with mental health and psychological problems, which range from people with mild depression to people with serious mental illness such as psychosis.
Okay, so currently how do the mental health services in Palestine compare to those in Britain?
The policy, to start with, the policy is very similar. The policy is about developing local integrated community services, both hospital and community, to people with various types of mental illnesses through community mental health centres, which are the same as in England, and through acute hospitals in general hospitals, which are the same as in England. We provide services for the range of the population, from children to the elderly, under one system. Of course, there are differences, of course, because of the circumstances in Palestine in terms of the economic and political situation, difficulty in access because of checkpoints and roadblocks, and people's inability sometimes to move from one city or town to another one because of restrictions of movement. But the implementation of this plan, which was done in 2004, is now about halfway complete in providing the infrastructure of the new services in the community, and with the gradual reduction of beds in 2 psychiatric hospitals, one in Bethlehem and one in Gaza.
Okay. And what do you hope to learn from your visit to Scilly? How's that going to help the plan in Palestine?
Well, first of all, we have had study tours to Cornwall previously, where people have come to look at the services and how they're provided, and to look at the governance arrangements and the management arrangements of services, and I've learned valuable lessons from this experience. This particular visit to the Isles of Scilly is to look at how a service is provided for a population where access is difficult on a regular basis to and from the mainland, and there are similar places, albeit not surrounded by water, but surrounded by barriers in Palestine, and is to look at, because there are a lot of scattered villages with small populations, it's a fairly mountainous area, and people are quite remote, so is to look at how services or lessons can be learned from here to provide services to these fairly remote populations in both the West Bank and Gaza.
It being a very different situation over there, with the problems over past however many years, it must be a very different mental health problems over there, or do you find that they are quite similar?
Well, the prevalence of mental health problems is the same. There's not much differences in terms of the particular illnesses, in terms of the rate of prevalence in the population. Of course, there's an overlay of post-traumatic stress disorder and of trauma-related psychological problems. But the research that WHO has done, and this includes Palestine is that most people have remarkable coping skills to cope with the circumstances, and provided that they have the basic needs of life, food, shelter, family members, support, recover quite quickly from these traumatic experiences. So then the longer term, the needs of the population are very similar to the needs of any population in the world.
What's the end goal of this study, and where do you think it'll lead?
For our visit
For you,
here?
yes.
I think I have been for 2 days or 3 days in Charlestown in Cornwall, National Health Services. I learned many things from the services there. It will be helpful for me to do it in Palestine, my work.
Excellent.
Yeah.
So, is there a plan of timing for this study, when it will end, and when these recommendations you come to will be put in place in Palestine?
Yeah, just to put it into context, this twinning collaboration between Cornwall Partnership Trust and the Ministry of Health in Palestine is a long-term partnership, because the transformation, the development of new services takes time, and therefore this collaboration is designed for at least 5 years. It's been now going for about 18 months. And also it's to build sustainability of support for the development of services in Palestine, for the training of professionals, and for the setting up of new services based on the experience of people in Cornwall. So this is one part. This study visit here is one part of a longer term plan to build sustainability. The World Health Organization is funding the development of the services in Palestine, but it won't be there all the time to support this program. But these collaborations with services, both in the UK and also in Italy and in France, are designed to go beyond the time that WHO is involved, so that if anybody needs further support or training, they can be provided by the places such as Cornwall Partnership Trust.
So will training of Palestinian practitioners and carers actually take place in the UK, or is it done in partnership, so it takes place in Palestine?
It takes place in both places. People come from Palestine to be trained in particular treatments and techniques, but also people from Cornwall and from other places in the world go to Palestine and spend 2 or 3 weeks working in the actual work situation alongside the professionals, the doctors, the nurses, the social workers, psychologists working in the services in Palestine.
And where's the funding come from? Is it mainly from the World Health Organization, partly from Palestine, partly from the UK?
The funding for this project comes from the European Commission, which is given to the World Health Organization to implement the program. But there are many other donors that are involved in providing support for non-governmental organizations working in Palestine, and also there has been financial support from the French government, the Italian government and the UK government, but that isn't happening at the moment.